All right, we gave a full minute. That's all that was promised, so that's all we're gonna do. For those who missed the start of this, there will be a recording, so you'll have the opportunity to watch another two, three, 10 times, I would say, depending on how high quality you think the production is. But really excited and appreciative of everyone who could join live. I'm going to go ahead and jump into the presentation, and I think we'll have good content today. So hopefully everybody can see our beautiful slide deck here. If not, Paulina will frantically wave at me and we'll get it rolling. But again, wanted to appreciate everybody for taking the time and joining us. We're here to talk about how healthcare facilities can take a smarter approach to security, and one that detects threats sooner, allows a faster response, and ultimately allows for keeping all people safe within the facility, both staff and patients. And just logistically, I wanted to mention how today will flow. We'll start with some of the unique challenges that healthcare facilities face. We'll look at why outdated um, systems are falling apart. And we'll talk about a proactive approach that I think Salient and Pelco combined to take. And along the way, we'll share some real world examples, a demo of the presentation of our joint solution, and talk about the measurable outcomes that hospitals are seeing. So along the way, there will be a Q&A portion. We'll do that at the tail end. There will be a slide specific to that. You can feel free to drop in questions into the chat or into the QA section. We'll monitor those throughout the course of today, and we'll keep an eye on it and circle back in the event that we don't have time to cover everything. So we'll address as many as we can. But with that being said, we'll dive right in. So give me 1 second here. Awesome. So by way of introduction, just wanted to kind of let you know who you're going to be hearing from today. There's my beautiful picture. I'm the Executive Vice President of Sales at Salient Systems, and Paul Smith. Earlier in my career, I was one who was kind of tasked with rolling up my sleeves and working with organizations to actually deploy these video systems. And these days, being in sales leadership, I'm less intimately involved, and instead of configuring systems, I just ask my team when the orders will be placed. So lucky enough to be joined by my colleague, and I'll turn over the microphone to Paulina for an introduction.
Thank you, Paul. It's such a pleasure to be here. My name is Paulina, and I think I have one of the coolest jobs in the security and technology space. My title is Technical Evangelist, and so you may wonder, what does a technical evangelist do? I get to speak publicly about one of the most iconic brands in video security, and that is Pelco. We were acquired by Motorola Solutions in 2020, and that started a huge transformation with a full rebrand, a portfolio of new devices. And so as part of that, I get to tell the story of this comeback and of how we're now setting the new standard for what it means to be a video security manufacturer. So really excited to be here and talk a little bit about how we can make this happen with our comprehensive approach together with Salient. Thank you, Paul.
Yeah, excited to have you. It's been a great partnership. Have enjoyed all the collaboration, especially even this year. We had the opportunity to work together out at the Pelco Summit in San Diego. We've got GSX upcoming, so really just an indication of the depth of our partnership. And somebody whose picture is not on here, but will be chiming in throughout the course of the presentation today, is Dan Berg, who is our technology partner manager at Salient. He runs point on every aspect of this integration from the Salient side, and he'll be walking us through the demo presentation a little bit later. So he'll also be there as my crutch whenever a question gets too technical, and I got to turn it over to him to answer. So appreciative of him joining as well. So just to kind of set the table here, I think it's important to establish exactly what the healthcare security challenge is, because it's unique. Unlike other environments, I would say healthcare institutions, they're open, they're busy, they're filled with people who are coming and going with far fewer restraints than other security implementations that we might think of, like corrections or education, where it's very locked down, it's controlled, or at least there's an attempt for it to be. And the fact that healthcare facilities have this constant flow of unknown individuals coming in and out along with staff makes it a unique challenge. I would say that the risks are fairly wide ranging without reading through the entire bullet point list right there. You have to navigate unique challenges where there's violence in ERs, in the waiting rooms. There's theft of drugs that are in supply within these facilities. There's constant threats, and of course, the balance is you have to be able to take care of all of those elements, but there's also an incredible privacy concern that is particularly acute within the healthcare space. And I think that balancing all of those is a really difficult task for people who are tasked with doing that every single day. So, I think I can list them out, but we know there's ample statistics to back the level of threat that I'm talking about.
Yeah, thank you, Paul. Just to add to that a little bit, completely agree that healthcare is some of the most complex environments to protect because you've got so many different types of areas, so many different types of threats, and the data really backs it up in a big way. So healthcare workers are 5 times more likely to experience workplace violence related injury compared to any other profession. And so that risk is just staggering. And it's definitely something that I'm sure for a lot of you is on top of your mind every day of how do you not just protect the people or the patients, but how do you actually make it a safe working environment? Along with that, right? If we talk about patients leaving when they shouldn't be and kind of not being in the right mindset to know where they are and to be aware of their environment, the risks also show that it's incredibly high for patients with dementia to wander off. As many as 6 out of 10 individuals with dementia will wander out of their room. And so it's critical that we work with technology that supports a whole variety of these risks and helps us address them. And of course, to your point, Paul, there's always budget constraints. There's always issues with aging infrastructure, and a full kind of upgrade of the system is sometimes just not possible. And so the technology that a lot of the hospitals and healthcare facilities have now is just not up to speed with the variety and the complexity of threats that we have today.
Yep. Sorry, I got a little trigger happy on the slide presentation there, but you're absolutely right. There's kind of the base level concerns, and then there's everything else that you need to be able to accomplish. There's the must-have, and then there's the unique aspects of healthcare that make the challenge even more amplified.
Absolutely. And that's a cycle we have to break, right? I think everyone on this webinar can feel the pain points. And the good news is that the conversation is shifting. Even the fact that we have, conversations like this today means that we're moving towards that more proactive security posture and investing into intelligent technology that allows us to have these incremental upgrades and modernize the system piece by piece, rather than having to say, hey, let's just rip out everything and start anew. So with that, establishing the risks, I want to talk a little bit about the operational reality on the ground. So when there's so much at stake, how do we even address it? And what are the challenges that I'm sure many of you are experiencing every day? Well, the first challenge is that we see so much outdated video security. So, of course, it's systems that provide low quality footage that's unusable when you actually need to investigate something. Systems that have limited coverage. Maybe there's some cameras that are down or are not recording what they should be. And a lot of the systems have no intelligence. We're in 2025, we talk about AI and all this technology, but a lot of our devices are not really up to speed there just because they maybe haven't been upgraded in years. But the technology is only part of that story, right? I think the bigger issue is reliance on manual processes and having teams that are overworked and stretched too thin. So I'm sure for a lot of your teams here who work in healthcare, the most time consuming thing is probably troubleshooting the technology, making sure that it's all operational, and making sure that, the cameras are online recording what they should be. And it's an incredible drain on resources that is detracting from those higher value, more strategic tasks that allow you to improve safety, improve security in those facilities. And so when we look at kind of the other side of the coin, not just the monitoring and making sure the technology is operational, and when we look at live monitoring and just noticing whenever something goes wrong, we're in this position where we put people in front of a wall of monitors and expect them to see everything. But human biology says that's just not possible. Studies show that after watching 20 minutes of video scene, humans operator will miss up to 95% of all activity. So let that sink in, right? 95%. We're asking people to do a superhuman job. And the data and the biology shows that it's simply not possible, especially in a high stakes, fast paced hospital environment. And so the reality becomes that our systems are an after fact evidence collection systems. So we're constantly looking back in the rear view mirror rather than looking at what's ahead and looking to improve and be strategic with where we place those resources. And that's a vicious cycle, right? When your video system is only seen as a tool for collecting evidence after something occurred, it's difficult to justify budgets for proactive technologies and those upgrades that can help prevent the incident in the first place. And in healthcare, the consequences of these operational gaps are on a whole other level entirely. We work at Pelco and Salient with a lot of different security operators from different fields, but I think in healthcare, the risk of having a camera that does not work or has been tampered with, but that's not been noted down, is just so much more critical than in a lot of other industries, because it can mean a disoriented patient elopes, or it can mean that you miss the starting stages of an attack or of an incident. And so it's critical that we have that technology that works for us and not against us, and doesn't make it so difficult to actually manage it and to make sure that it's operational.
For sure. I think that especially within healthcare, it's evidentiary. It's kind of cleaning up after a potential tragedy or high stakes incident. It's not a retail situation where a high dollar item has gone missing. I'm not belittling that or saying that that's not an issue, but it's incredibly high stakes in healthcare. And to your point, there's a lot of things that are possible with technology, but so much activity, so much time is spent around the very basics of a system. These 1, 2, 3, and 4 are all real world examples that we've encountered. I walk into a lot of healthcare facilities, and you walk in and they still have DVRs and analog cameras, and the operators are tasked for the first 45 minutes of every single shift with clicking through on a camera by camera basis to ensure that, is it online? Is it focused? Is it looking at anything? And there's kind of a reflex and a desire to jump towards all the things we want to do, but there still are kind of the boring ho-hum type things of getting a base foundational system that actually allows for you to build on it. So I know that's, again, not the most fun element to talk about, but it's huge for risk mitigation. It's huge for avoiding instances. I know in 2022 there was an incident for a shooting at Methodist Dallas, and 2 nurses lost their lives. That's an example of how paramount and important these things can be. And while the footage that was captured was crucial for evidence and for the investigation, the system didn't prevent it. And so it's really important that you get the base foundation figured out so that you can take and elevate the technology to help stop these events in real time. So, obviously Salient and Pelco here today talking about the unified approach and how we think our collaboration and technology can really head off a lot of these incidents. I would just say it's important to point out that, we share a deep commitment to open platform technology. Salient has always been focused specifically on the VMS side, but trying to be open platform, trying to provide the opportunity to tie in a bunch of different technologies that are going to affect outcomes for our ultimate end users, and give our integration partners the ability to make a recommendation that gets an end user like a healthcare institution the best end result. But that's why this integration runs so deep, is we've seen that exact sort of strategy on the Pelco side. I don't think it's a shock to many who have seen, especially just in the last couple of years. You talk about the acquisition from Motorola, but there's been a huge focus and commitment from Pelco to being open platform, to having a wide portfolio of products, and to give ultimately our end users on the healthcare side or in other verticals opportunity to select the right products that are going to achieve the results that they're looking for.
Absolutely. It's so critical to have the right tools for the right job, right? And not just that, but the tools that integrate well with the systems these facilities already have, working together and acting kind of intelligently, building up on top of each other. I think we'll show a bit of a demo in a little bit, but it certainly speaks to just the power of our collaboration and our integration, of how much there is the interplay between, the intelligence that happens from the camera perspective to the VMS, and how there's that interplay, and you can automate so many of these workflows and help operators respond faster, detect threats, like you said with that horrifying example, right? It's not just about making sure that you have clear footage of what happened after, but making sure that you're ready to react and respond in the moment.
Yep, for sure. And I would point out that though I'm a Salient representative, you're a Pelco representative, the reality is the operators of these systems, they don't care about the brand names, right? They ultimately care about what the technology allows them to accomplish, what can be achieved with these systems. So as much as we're focused on the Salient and the Pelco of it all, it's really about what that integration accomplishes for the end user. And I think a really important aspect to that is really the analytics side and some of the stuff that can be accomplished there.
Yeah, thank you for that. And I think this is the big picture of the unified system, right? Of how it all works together and the outcomes that it delivers. But I want to dive a little deeper into how we actually deliver that intelligence and how we make it work. And I think the magic really begins at the edge. At least that's something that I'm constantly nerding out about and pinging our engineers about. Hey, can you tell me more about how this works? So our cameras are not just passive recorders, right? The times of cameras just being recorders or just having motion-based analytics are long gone. So currently Pelco cameras are intelligent sensors with powerful AI-driven analytics running right on the device. And so that data is constantly feeding into the VMS, making sure that that whole system is intelligent by design. So our cameras are constantly analyzing scenes in real time to detect things like anomalies and turning that raw video into critical and actionable, most importantly, information. So the key that these smart analytics are designed to work seamlessly together with systems like Salient's Complete View. And how do we make this happen? Because Pelco devices are ONVIF conformant. I think we're just talking with the team here earlier before we jumped on. Both Pelco and Salient are active participants of ONVIF committees, and we're constantly making sure that we're integrating those standards into our product development. So you can think of ONVIF as a universal language for security devices. It guarantees that our cameras and their intelligence can talk well and clearly to platforms like Salient. And the best part that these rules and these analytics are very easy to set up and customized, which is something that Paul's going to share in a little bit in the upcoming demo. So an example of that would be setting something like object loitering or objects in area analytic to automatically alert security when a person is detected near a restricted exit, stairwell, hallway, triggering an immediate response. Or it can be for protecting sensitive areas, like, let's say, a pharmacy. I think Paul mentioned that one of the risks is really the drug diversion, right? And that can happen from someone at the hospital being in the area that they probably shouldn't be in past the time that there should be someone in that area. So you can set a virtual tripwire by setting objects crossing beam. And the moment someone crosses that line after hours, the system flags it, helping prevent unauthorized access. So there's so many different use cases and ways to leverage that system to be intelligent and to alert you of things that shouldn't be happening, right? But it's not just about detecting external threats. It's also about looking inward and making sure the system on its own is working as well as it should be. So ensuring that your cameras are always ready to perform and are always operational. So this brings me to our next talking point, which is Elevate. If you don't mind changing the slide, thank you so much. So I mentioned system health, right? And let's be honest, the worst time to find out a camera is offline is after something happened. You go to pull up that footage and you realize, whoops, it was offline and not recording, or it was turned to the side and misaligned and didn't actually record the scene you were hoping for. So Pelco Elevate solves this problem. It's our camera to cloud management and maintenance platform that combines AI at the edge and in the cloud. And so at a high level, Elevate is a tool that ensures your entire security system is always operational, up to date, and optimized. It enables operators of Pelco cameras to self-monitor, auto-update, and receive real-time alerts without additional hardware. So Elevate, a lot of the Elevate features come complementary with Pelco cameras, and it's a super quick and easy way to kind of turn it on. So for security leaders here today, it simplifies maintenance and reduces the strain on your teams, again, getting rid of that manual checks and making sure that your system's always working properly. And I know we have a few security integrators in the room with us as well, or in the virtual room. And Elevate can be a real game changer here. So it enables you to offer proactive device management and simplify your service contracts. So you can help your customers make sure that their installations are always functioning and are always on top, in their top shape, even after deployment. So in short, Elevate provides the confidence that your investment in security is always protected and is always ready to perform. And it's so critical in healthcare settings where it's really important to ensure that the technology that you have is ready to react.
Yeah. Just real quick, we talk frequently. We're brought into a lot of situations where, to your point, frustration levels are high because an incident occurred, and you find out that this camera's been down for a weekend or several hours at minimum. And I think the key point with a lot of the examples that we've cited and others that people can find within healthcare is these situations typically pop up over the course of seconds. So we're not talking about minutes or hours or days. It can be the difference between capturing an event where, you talk about the loitering thing. And I saw a statistic that talked about one of the biggest elements of that instigates an incident within healthcare is congestion and kind of people being on top of one another in distressful situations. So, again, you having an entire weekend or an hour or a day or whatever it is without footage might mean the difference in either capturing an event or not. But once you layer on the analytic capability that Pelco offers and that triggers directly within your base VMS, to go back to the earlier point, if I'm sitting here staring at video all day long, I might be a very highly trained individual who is looking for certain things, but having a specific call out within the VMS platform that detects a certain situation as a byproduct of what Pelco can provide allows for an alert that I can respond to incredibly quickly. And I know that I have the foundation of a system that's operational, it's effective, it's online. So all these things ultimately do end up tying together to give the best solution possible.
Yeah, and thank you for kind of bringing up that example of absolutely. It's just it's a weekend. Let's say you're staffed low, and you don't have the people kind of to look after and do those maybe routine health checks. Again, we're in 2025. AI is the word. Why don't we automate some of these workflows?
Yep.
Um,
And once again, I got a little bit trigger happy on
oh no.
the slideshow just because Halo, I think it's a frequent topic that we run into. It's something that we're really excited about, and I think it has specific applications to healthcare.
Absolutely. Because Halo helps address that huge privacy gap that we have. So in patient rooms or bathrooms or maybe even staff locker rooms, these are all critical areas where incidents occur, but you can't put a video camera in there, right? So it's a security blind spot for legitimate privacy concerns. But sometimes incidents really start happening in some of these areas where you don't have that situational awareness. So we help close that gap with Halo Smart Sensors. While Halo was an industry leader and it's kind of was introduced to the market as an industry leader in vape detection, it is so much more. It's an all-in-one smart sensor that has so many different capabilities in one. So it can detect the sound of a gunshot, identify aggressive shouting, or even calling for help. And it does it all without recording sound. So again, you're making sure that you're being privacy friendly, you're not impeding on anyone's desire to be left alone, right? It can also monitor air quality for chemicals or smoke, again, making sure that that environment in the hospital or healthcare facility is clean and safe and comfortable for patients and people working there. So it provides this comprehensive layer of safety and security, adding that intelligence in the most sensitive areas. And of course, it doesn't operate in a silo. Now, because of our seamless integration with Salient, Halo Alert, whether it's a vaping in the restroom or cry for help in a patient room, instantly becomes an actionable event in your VMS. So it can trigger an alarm, call up a map within your camera feed, and log the incident after it's been complete for a unified response. And of course, I talked a lot about intelligence and kind of AI. Our Halo also can connect to the cloud. You don't have to do it, but you can, providing a dashboard and historical reporting. So you can be, again, more proactive and have these trends that are identified and start addressing root causes rather than just having kind of alerts pop up and not have the historical data to analyze. We actually recently did a webinar with Salient, diving a little deeper into Halo Smart Sensors. I think we'll be sharing it in the post-webinar follow-up email. So I definitely encourage you to click on that and learn a little more about this powerful device and its use cases, because there's just so many, not just in healthcare facilities, but in all different kinds of settings that may not be super obvious to start with. And so I kind of want to wrap this section of the webinar before we dive into the demo by saying that combining all these intelligent sensors, whether it's a camera or an actual sensor, the power of Elevate and Edge Intelligence, with Salient's VMS, we've built a system that sees more, hears more, and understands more. It transforms security systems from a passive recorders to proactive intelligent partners in safety and patient care. And it's so critical that you have that partner when it can take seconds for an event to unfold, and security technology that's already in place, again, can be difficult to manage sometimes. So I'll bump it over to Paul and Dan to share the video and share how this all actually works in real life.
Yeah, and I appreciate you mentioning the prior webinar that we did. I would point out that for each of these slides that we're trying to be, efficient on and cover at a high level, there's plenty more to explore, and we had the opportunity to do that specifically with you guys in a prior webinar. So, I would just point out that we're going to keep things as high level as we can so that we don't keep you here for 4 hours today. But there's a lot more to talk about, and it just talks, it speaks to the fact that Pelco has really built out this portfolio that we're excited to partner with. It allows us to really focus in on the VMS element of it. How do we provide an interface that people can interact with, but take advantage of all these edge capabilities, these things that Pelco and Motorola have made a massive investment in. So as you said, we're going to take a look at how this works in practice. And at this point, I will click over to our video demo and turn the mic over to Dan Berg, again, our technology partner manager, and he's going to walk us through what the integration actually looks like here. So let me get that rolling here.
Thanks, Paul. All right, so apparently we lost Paul there for a little bit. So let me share my screen. I'll just do this live. Hey, even
Sounds
better.
Great.
Yeah. All right. So what you're seeing here is the user interface for our Complete View VMS. And it's a kind of I set this up as a healthcare facility. And I've got a map of the facility here in the upper right corner. And you'll see that I've got various flashing cones on these different devices here. And this is one happens here. This is a Halo. This is the dashboard of the Halo sensor that we record as video in Complete View. And that can be tied to another camera. Let me just fire off an event here. So now you see that it detected a vape, some vaping, right, in that waiting area there, but it also pulled up another camera. Okay, and let me go to our alarm view to show you what that really looks like there. Do that again. So as Paulina was saying, the Halo sensor, there we go. There's two cameras that pulled up, well, the dashboard of the Halo and then the associated camera on it. And they're both flashing there on the map, give you better situational awareness. But the Halo sensor is really versatile, and as well as telco cameras. But the Halo can be used, as she said, in pretty much anywhere where you can't put a camera. And it goes way beyond vaping. It does smoke detection, gunshot detection. You can program in keywords. So if you've got maybe a staff at the ER entrance, right, that's being threatened by somebody, they could say some innocuous word, unicorn, or that would not provoke the belligerent person, but would alert security that there's an issue there. They can also be used in other locations for things like air pressure monitoring. So if you've got in your healthcare facility, if you've got a quarantine room that has to have negative pressure so that nothing gets out, you can put a Halo in there, and if that pressure goes up, the air pressure, that becomes an alert in the VMS. So very, very versatile. And again, you can pair them up with cameras. What's really nice is that, let me show you here, with Pelco cameras, we support them using our OnVIF driver, and the number of events, different analytics that those cameras are capable of is really impressive. I mean, from audio detection, crowd size growth, crowd size threshold, number of people in there, we get crossline detection, object left, object removed. It just keeps going. And then here are the Elevate analytics. And what was really nice is here at Salient, we didn't have to do anything to make that work. Just happened out of the box, which was awesome. So we do have firearm detection on this particular camera. Let me go back to my alarm view here. So we've got one of our engineering managers was so helpful in wandering around there with a couple of toy guns just to get the detection. So what you're seeing there in the lower right corner is, on the left side is the current live view, and then on the right side is that recorded detection event of a weapon. And likewise, I can pull in an alert from the Halo, as well as the associated camera with that. And that'll play automatically. Okay. And there's other analytics that are available on the camera. So some of these here in the parking lot, I've set up for things like wrong direction of travel. All right. So if you've got a driveway where people are dropping off patients or staff, and somebody's going the wrong way through that, that's a safety issue, right? So these cameras can alert in the VMS on that situation. Also, if their vehicle is too long in a certain spot, say by the emergency room, again, an alert coming in allows you to be more proactive in your facility management. Okay. And any questions on that?
Let me just share my screen here. And I'm taking a quick look at are you able to see the slide deck here?
Yes.
Perfect, fantastic. Well, glad that we could make this work and have technology to cooperate. And thank you so much, Dan, for showing that demo. I think, having, I love the use case that you shared here with Halo Smart Sensors of monitoring air pressure and making sure that it stays at a safe level, so none of the potentially harmful chemicals or viruses get out of that room, and things like Elevate's firearm detection. Again, firearm incidents are thankfully rare in healthcare facilities, but when they do happen, it's usually in emergency rooms in areas where you have people at the most risk, where it's a really fast-paced environment. And so it's so great to have kind of technology that's able to identify some of these threats instantly and with a high degree of accuracy. And so this demo showed us a powerful look at the how, and we just saw that the user experience is designed for clarity and speed. It's pretty easy to configure some of these alerts and to check what's actually happening when you do get an alert. But as we wrap up, I want to zoom out of the interface, sorry, and talk a little bit about the why. So for security leaders or integrators here, I think all of you know that features and specs, it's all great, then they all start to blur at a certain point. The real measure of a solution isn't just its features and what it can do, it's the value that it delivers, right? So I want to frame it in terms of tangible outcomes and talk a little bit about kind of scenarios that we heard from some of our customers and that we know some of this comprehensive approach to video security can help address. So first and foremost, of course, safety outcomes. So if you imagine a high-risk patient room, a place where a camera is not appropriate for privacy reasons, inside you can put a Halo Smart Sensors that is discreetly monitoring for occupancy. And so in a case that a patient who should be resting has left the room, Halo sensor can detect that the room has been unexpectedly empty for too long. So, it's not just a bathroom break. It's been, let's say, over 5 minutes. You can set up that threshold. It can automatically send an alert to the operator. And I think the next step is really where the power of this integrator approach comes in. So from there, you can instantly highlight the camera in the hallway next to that patient room and highlight it to the security operator to make sure they can check what's actually going on. And maybe they see, as in our example happened, a patient that's looking disoriented and can dispatch a nurse to safely guide them back. So a crisis is averted without a single alarm bell ringing and the whole hospital staff running around and trying to find that patient that eloped. So that's moving beyond security to become a true partner in patient safety. Now, of course, it's not just about safety outcomes. It's making sure that the security teams are operating as efficiently as possible, because we know you likely have a small team that's doing too much and they don't have all the resources in the world, right? So if you imagine that you get a report about a slip and fall incident, and the only kind of narrowing down context for that is that it happened sometime in the morning in the lobby. So in a traditional system, that means that one of your operators will have to start the tedious process of scrubbing through footage and looking for that incident to happen. But if we're using a system with Salient's forensic search tools on the video and Pelco camera analytics, you can tone it down to just a couple of minutes. And so AI camera is already classifying objects. So it's classifying, hey, there was a person here, maybe they fell, and the operator can quickly narrow down the search field and get a couple relevant clips that help them research the whole incident and kind of figure out what happened. So this is freeing up security teams to manage the present and not just investigate the past. And finally, and maybe the most critically, when you're making your case for having a budget for security upgrades and for adding more security, having technology that helps you not just with safety and operational outcomes, but also helps you improve compliance, and having an intelligent system that provides you with a better use of resources, you can use all that to justify ROI on more upgrades. And so I think with healthcare, as many other industries where there's sometimes, again, that push and pull for budget and for having some of that modern technology in place, right? You first need to prove probably that something's actually happening in that area that we need to justify, because until something happened, it's really difficult to say that, hey, we actually need to put new cameras in there and we need to put AI analytics. And so perhaps starting with, a couple of the high risk spots like the emergency room or maybe the entrance, you can use some of that technology to simplify that conversation that you have with your management to say, hey, we've logged this many incidents of aggression towards our staff. Or, we have all this evidence of, let's say, slip and fall incidents that didn't actually happen, right? And so having that behind you really helps you make sure that next time you're making that budget ask, you're coming from the place of having the data and having the tools that help you upgrade that system to the next level.
Just kind of catching up on some of the items that you hit on right here. Research shows that security breaches most frequently occur associated with higher mortality. So there's a direct link between these two. It's not an anecdotal type thing. There's actually evidence that when there are poor security implementations, there's a direct negative result right there. And you also hit on one piece of it that speaks to ROI justification, which is we have a lot of examples of not purely preventative violence scenarios, but how hospitals are reducing legal and financial kind of potential outcomes. We've had specific instances where somebody did claim a slip and fall. They suffered allegedly a very serious injury. They were already in the facility, and even to fight that is incredibly expensive. So having reliable footage that you can count on to go back and review and disprove an incident like that, it ends up being one of those items that you can look back at years past, see how much was paid out in these instances, how much we suspect it actually occurred versus didn't, and did you have counter evidence. But I like what you pointed out, that you can be kind of choosy. It's not an all-in-one proposition. You don't have to do everything or nothing. You have to get the stability, you have to get the reliability, and then you can make progress towards what you want the outcomes to be in the future by taking on the most high priority items that are going to ultimately make the facility safer and more secure.
Thank you for jumping on and kind of adding to that. Glad our technology works, and this is why you always have a backup friend that helps you with sharing the screens. But absolutely, yeah, it's, I think, having that operational technology and being able to make the case, not for a full rip and replace, but for those incremental upgrades that add intelligence where you need them. This is what we're all about, right? And this is why the open platform approach is so important, where you're not locked into one system that says, hey, if your license expired, your camera is bricked, basically. We're really taking that approach of, hey, you want a couple Pelco cameras in your most critical spots, you want them to work with Salient, you got that.
Awesome.
Perfect.
Totally agree.
Well, I think this leads us to the Q&A section of the webinar. So we'd love to hear your questions. I think we've got the Q&A box here. So if you've got anything for anyone here in the audience, feel free to send the questions our way.
Yeah, I'll scan through a couple. While I was having my technical difficulties, I at least had access to the chat and honed in on a handful of them. So we've got one that's related to compliance. How does this system help with compliance, especially HIPAA and Joint Commission requirements? It's a great question. I mean, we mentioned it very early on in the discussion today that obviously we're talking about what we can do to ensure safety and the proliferation of devices through a facility, but the counterbalance to that that things like Halo help assist with is ensuring the compliance side of things. I would just point out that from the Salient side, our VMS, it includes secure audit trails, role-based access and permissions that are enforced. You can integrate this with your Active Directory system to maintain who needs to see what and who needs to be able to do what with the system. Evidence exports. We obviously want to make sure that the chain of custody is in place, and all of those tie into the HIPAA and Joint Commission requirements. And I think, not to answer for you, but I saw Dan Berg come off mute there, so I'm sure he's going to enhance my answer here.
Don't forget about data encryption on disk.
Absolutely. I did forget, and I thank you for hopping in. But on the Pelco side, again, loitering, aggression, objects left behind. those are not identity specific. It's not Paul Smith doing this thing over here in this room. It's about denoting the event itself, but maintaining privacy. And I think that's a critical piece.
Absolutely, yeah. And so I think another kind of piece to add to that from the device perspective and how that helps you ensure compliance. So all of our cameras are NDA compliant, meaning that they're made in North America, meaning that it is safe if you get federal funding to put those cameras into your facility. Another aspect of that is, I think we talked a little bit about some of these audio analytics and audio detection. So in case of Halo smart sensors, they don't record any audio, meaning that you're not in breach of any compliance, but you get that ability to identify any audio anomalies. Similarly, on our cameras that do come with microphones, we have generally options with and without. So if you choose to go with the camera with the microphone, you can turn it on or off. It comes off on default. And so it's definitely something that we want to make sure that you're not, you're not having audio going somewhere where it shouldn't be. And to add to that, there's so many different features and so many, to Dan's point, like encryption and making sure that we stay on top of our firmware upgrades, and Elevate helps make that so much easier. But we also have something called dynamic privacy masking. So if you've got, let's say, a bathroom and you don't want to see who's, going in and out, you just want to make sure that you're kind of seeing the area or maybe the hallway around it, you can set up a privacy masking area using Pelco Camera and Salient's VMS to make sure that, again, you're not impeding on anyone's privacy there.
Yep. And I mean, even showing sensitive patient information, right? We want to make sure that that's not visible within any of the recorded footage. So those privacy masking zones, they end up being implemented over on the Complete View side. So it's happening at the edge, it's coming over, and it prevents any sort of privacy concerns that might come with that. I'm going to pick out a softball here just because we kind of touched on it already, but can a hospital with outdated analog cameras still benefit, or is a full overhaul required? I mean, no, I think that's what we're talking about, getting the foundational VMS in place, picking out those really critical spots, because budgets are not infinite and we have to be smart about how dollars are allocated. So being picky and choosy to start with, showing ROI, and then building on top of that, that's really what our combined platforms allow for.
Absolutely, yeah. That phased approach can deliver so much value and significant return on investment, allowing you to maximize what's already in your budget. And it's always, at least for me, fun to hear about those projects where we see the old analog Pelco cameras. We've been here around for a while, and as people like to say about our products, they just don't die. And so there are cases when you see sometimes really old cameras, whether it's analog or it's a camera that only has motion only alerts. And in that case, we also have a product that helps make your cameras a little bit smarter, a little bit more proactive. So it's definitely kind of meeting you halfway where your resources are and making sure that we can work and optimize what you've already got, and adding that maybe newer cameras, newer intelligence where you need it most.
Yeah. Why'd you have to make those cameras so reliable? Didn't you realize that was going to stop you from selling more in the future? So another one, and I'm sure this was touched on while I was frozen. How are alerts from devices customized within the Salient VMS? Within Complete View, the alerts, they're very customizable. I'm sure Dan demonstrated, the wide variety of rules, and there's even more levels that can go to: the time of day, the severity of what we're talking about. If somebody's loitering in the lobby, it could pop up instantly on the screen. And while maybe something like a camera tampering is something that you would address later on at a predefined time, so you can kind of do as you see fit, but you have customization capability between all the things that are possible with the Pelco devices directly within Complete View.
Yeah, thank you, Paul. That's a great overflow. I don't have that much to add other than just how important I think it is to have these alerts be high quality and specific, because I'm sure everyone here is familiar with having a million alerts that all end up being false positives. And so we make sure that when we train our AI models and our recognition of anomalies, those detections are true detections and they're accurate to whatever something's happening. So whether it's identifying between a person walking past or just like a leaf shaking and kind of making a funny shape, it's definitely making sure that those alerts are not just customizable, what Paul has kind of mentioned, but they actually they send you down the true event and what's happened, rather than just having something that ends up being a false positive.
Yeah, absolutely. And just being conscious of time, I think we were targeting about 45 minutes. We're a little bit over that. For me, it's been about 45. For the rest of you, about 50. But just to kind of tie a bow on it, what resources are available to learn more about designing systems with either of the products? You know, I am hyper aware of what's available on our website. I think your team has done an incredible job of building out the Pelco kind of portal as well. Just on the Salient side, there's case studies specific to healthcare. There's design guides. There's a design tool. There's technical papers. There's training information. So I would encourage people to visit salientsys.com for information specific to the complete view side. But Paulina, maybe you want to speak to some of the stuff on the Pelco side as well.
Yeah, thank you, Paul. And just to answer one of the questions in the chat box here, this session is recorded and we will be sending it out. So not to worry if you've missed a portion of it, or you want to rewatch our faces and you want to learn more about this, definitely this will be sent to you. Perhaps you can share it with your team. But if you want to learn more about Pelco, pelco.com is where I would encourage you to start, or feel free to reach out to me. I think I will show trigger happy on the slides here as well. I will be happy to answer any of your questions. On our website, we have things like data sheets, any specifications and tools. So for any of you that are security consultants, we have great plugins for Revit and great tools for system design. So I definitely encourage you to check it out. If you're an integrator here and you decide to partner with Pelco, you get access to our Partner Advantage program, which has so many different incentives and product training, co-op funds, demo program, and so much more. But I like to say that the best resource we offer is our people. So in North America, we have a fantastic network of regional sales managers, sales engineers, and all kinds of solution experts that are here to take care of you, that are absolute subject matter experts on the Pelco portfolio. And so if you would like to meet any of us in person, I would highly encourage you to visit us at GSX. We'll be at booth 1027, that's the Pelco booth, and we'll have a Salient integration there. And so you'll be able to kind of see everything that we talked about today for yourself with a live demo system. So definitely would love to see you there. So thank you so much for your time. I know we ran a little bit over time, and apologies for a little bit of the technical difficulties there. It's been such a pleasure to have an opportunity to talk to you about this and to talk about some of the challenges in healthcare and how we can address that. Again, would love to see you at GSX. And if you have any questions, feel free to reach out to me or Paul, and we'll definitely send you the right way, whether you have questions about Salient or Pelco.
Yeah, looking forward to getting connected. Paulina, appreciate collaborating on this and you taking control when I failed. But as you said, we'll both be at the GSX booth together, and really excited to have those conversations in person. So apologies if we didn't get to all the Q&A stuff, but we absolutely will follow up, or we can set up a specific time to discuss in person. So appreciate the time and appreciate everybody being available for the 56 minutes that we had you. Hope you have a good day.
Thank you so much.
Thanks, everybody.
Thanks.